sound check. Okay, Jill Ludford, Chief Executive of the Murrumbidgee Local Health District. Okay, just try and fold up my mask there. Okay, good morning. We're here today to provide an update of COVID-19 across the Murrumbidgee region. And look, today is actually an important day. It's the day where we are moving into an easing of the restrictions of which we have been living with now during this Delta outbreak of COVID-19. And we're going to start to see some different behaviours and people moving around. And the message today really is, for regional New South Wales, we do need to exercise a degree of caution as we still have case numbers out and about in our community. So let's just start with the case update from the weekend. So today we're reporting 2 new cases in the Edward River. The good news is that both of those cases are either close contacts of an existing case and in isolation, or linked with an existing case. So what I'm saying to you is there hasn't been additional community transmission in the Edward River region. There are no further cases in Wagga Wagga after the school, the Kildare transmission that we saw last week. And I do want to thank both of those communities who have come forward for testing. In Wagga, for example, on Friday, we did over 1,000 tests in a day, which is 5 times the normal amount. So the community has come forward and got tested in really good response. Testing can never be more important. Yes, we are going to see cases as restrictions start to ease. And the way that we can keep our communities safe is by coming forward for testing. What we're seeing with COVID now really is that the disease is not just a respiratory disease. We're seeing people with headaches. We're seeing people with like spring hay fever type symptoms. We're seeing people with chronic conjunctivitis. So if you have any of those symptoms, please come forward for testing. So I'm just going to give you the numbers by LGA now. We have had 46 cases of COVID-19 in this outbreak. So Edward River is now up to 8, Wagga Wagga 2, the Federation Council 1, Griffith 1, Hilltops 29 and the Albury LGA, Hilltops 25 and the Albury LGA 9. We've had one new location that we are reporting today, which is the Wagga Wagga Fruit Shop. And that was an exposure there on the 6th of October between 9:15 and 10 a.m. And there are no new locations for the Edward River. Sewerage. So sewerage detection remains a really important way that we can make an early identification of COVID, fragments being in a community before we start seeing COVID cases. So we have had one detection that is of concern, which is in the West Wyalong LGA, and so we have been testing there since yesterday, and we're again calling for people to come forward and be tested if you're concerned at the hospital between 1 and 3 today. So really important, that sewerage detection. The other thing that changes from today is the visitation to our hospitals. It's been a very difficult period for families of patients in hospitals and in our aged care facilities over the last number of weeks, where we've had no visitation except at end-of-life paediatric or maternity. Now we're really pleased to say for people who are fully vaccinated, they can visit their loved ones in hospital, so patients can have up to 2 visitors for up to 2 hours a day if those people are fully vaccinated. Can you please help our screeners who are at the front doors of our hospitals, because you will need to show evidence of your full vaccination certification before we can let you in. For patients, we have no requirements around vaccination, and I just want to stress that. We care for patients no matter what their vaccination status. If we have people who are at end of life, or maternity patients or paediatric patients, and their loved one or family has only had 1 or no vaccination, we can go through a risk assessment process to see if we can make some sort of agreement to help that person to visit their loved one in hospital. So that same applies for our aged care facilities. Our beautiful aged care residents have really done it tough in recent weeks, being separated from families And it's really great news today that they can receive visitors again, up to 2 visitors allowed for our residents in aged care facilities. But we will not allow children to visit in the aged care facilities. It's only 12 plus. So some changes as we're starting to see. We're still running our vaccination clinics. As we know, with the changes in the roadmap out of COVID-19, vaccination plays a really critical role. Vaccination and the public health measures together are the ways that we can transition into our new way of living. So for vaccination, we had a huge weekend. We had walk-in clinics across our region, and we did 2,999. Disappointed we didn't get to the 3,000 last week, but it was a really great week of people coming forward. As I've said to you before, our role as the state government is now to ensure that we're offering vaccines to people where we see there may be a gap. So we've got quite a lot of pop-up clinics happening this week, and again, we are welcoming people who may not have a Medicare card to come forward. You do not need a Medicare card to be vaccinated in our clinics. So we're doing clinics in Leeton, we're in Deniliquin all week, Henty, Albury and Ashmont on Friday. So again, really going out to population groups where people may not be able to get in and see their GP or their chemist. And our staff vaccination rates are also going well. 98.4% of our staff have had that first vaccination. We've got really great compliance with our staff vaccination. So with that, I'm now going to hand over to my colleague from New South Wales Police, who's going to talk about the weekend and staying safe as we ease our way out of the previous restrictions. Thank you.
Good morning. Acting Superintendent Winston Woodward from the Riverina Police District. I suppose if there's any questions you'd like to ask of me specifically, rather than me give a whole rundown of the weekend.
So Winston, obviously we know about a breach with the potential video circulating online. Can you tell us if that's something police is investigating and whether, any fines will be pending from that one?
Yeah, which video was that one?
The one that I sent you this morning.
In relation to?
The football club.
Mangapla Football Club?
Yeah.
In relation to that, you are aware there is a video circulating. It was a private video which was released. It's out there now in the public domain. The matter's in the hands of our licensing sergeant, who I believe has already made contact with the football club, and we should know a little bit more this afternoon, but it is under investigation.
Can you stipulate what breaches are in particular are under investigation, or any more details on that one?
Well, look, just looking at the video itself, you could tell that there was a couple of close contact breaches there in relation to the public health order. Once we speak to the football club, I'll be able to give you a little bit more specifically in relation to the investigation.
But I suppose any message for the public, given that we've now reached this Freedom Day, but there still are restrictions in place, any kind of warning there?
I think the biggest message to get out there is everyone's talking about Freedom Day. We have to still remember that we're all still subject to the public health orders, and I think we should walk before we can run. I think it's some good advice that was given to me once, and I'd just like the communities to think about that before we actually go out, go too hard and find ourselves in a situation which may be worse than what the current situation is now. We've come out of lockdown, it's getting good. I shouldn't say worse, but I should say it could get worse. There could be more hospitalisations, but I'm not an expert in that, but I'm only going off the general knowledge that everyone has. So please remember that we're still subject to the public health orders, and take it easy and ease into it.
And lastly, early days I know, but fines could potentially come from that incident?
In relation to the football club, if there are breaches of the health orders, we will take action once the investigation is complete. But I can't speculate too much until we actually complete that investigation.
How will police be tackling vaccine compliance of businesses with the new roadmap rolling out today?
Yeah, good question. We still enforce the public health order. So I think everybody has to be aware that businesses, they're going to find it a little bit tough going first off. It's something that we've never been subjected to before. But there's plenty of signage and everything that can be put out by local businesses. If you're a small business, you're probably going to find it a little bit harder. You're not going to be able to have the personnel and the staff to check everybody that comes through the door. But if you're a larger business, clubs, those, industrial, things like that, you might have the personnel available to you to be able to devote someone to do some checking. And as I always say, if somebody does not want to sign in, ask them to, but don't get into a violent confrontation to it. Just call us straight down, we'll come down and we will have a word with the person, and if there are breaches of the public health order, we will take action. But I don't like to see small business owners getting in violent confrontations with members of the public over a QR code. I think that's our job, to enforce those public health orders.
Is there any particular businesses that police will be, keeping an eye on over the coming weeks in terms of vaccine compliance?
Well, it's a natural phenomenon that as the weather warms up, the licensed premises open up. The alcohol-related crime and those type of antisocial behaviour and violent offences which happen on our streets, we will be paying particular attention to the alcohol-related crime. And as we move away from the public health orders and the Covert compliance, we will go back to our core focus of alcohol-related crime with our licensed premises. So the opening up is not a green light just to go out, get drunk, commit offences. We have to have some common sense about it. And I'm just asking on the community, of all the good work that we've done, don't go undoing it by being silly in relation to alcohol-related crime. Just ease into it and let's hope we can move forward that way.
And how has COVID compliance been over the last week?
I think it's been pretty good. I think there has been breaches and people have received penalty notices in relation to it. But overall, I think people are, I hate to say we've become used to living with COVID, but I think we have. We've become used more to face masks and we've become used to, it's going to be with us for some time. As I said, I'm not an expert in that field, but you can tell it's going to be with us for some time. Just move forward small steps in my policing field and just watch yourself in the licensed premises. Don't undo all the good work that we've been able to achieve.
And just lastly, how many penalty notices have been handed out in the past week?
I don't give out numbers in relation to penalty notices, but there were offences detected and we did take action.
Are you able to indicate what types of offences you were looking at in the past week?
They're the average top two QR offences and not wearing the mask indoors. They're probably two of the most ones that come up all the time.
Have you had any instances yet this morning just in regards to breaches of those new vaccine rules for businesses?
No, haven't. So I think everything's travelling fine up the CBD of Wagga. We haven't had any adverse comments from our sectors, so I'm hoping that everything's going forward and people are just being patient. I think that's what's called for, patience. Thank you.
Okay, Dr. Joe McGurr, independent member for Wagga Wagga. Can I just start by thanking my colleagues Jill Ludford and Winston Woodward from the police for their information this morning. Can I also particularly thank the community of the region and particularly my electorate. Some outstanding results in terms of vaccinations over the weekend and of testing, and very positive news that only a limited number of cases, and they have been traced to other cases, have been talked about this morning. So that is a really, really good news. And this is a period where we need to be very cautious. Now, I know that in the city, they're all talking about Freedom Day, and of course they've been in lockdown for months and months and months. It's a different picture for us. And I think that's okay. I mean, we haven't been in lockdown, and of course for people who are not doubly vaccinated, there are some restrictions now coming into place on what can be done. So although there are some additional freedoms here, there are also, some people will be experiencing some restrictions. So I like to see this as first step day. We're on a journey now to the 1st of December. I've said before that our regions do not have the same vaccination rates as the city, and so we are more vulnerable. And we need to be very cautious in the next few weeks, because come the 1st of December, there will be basically, things will open up completely, and in just 2 weeks' time, we will have travel coming to our region from the city. So we need to get ready. And what is happening today is the first step on getting ready. We need to concentrate on getting our vaccination numbers up. We need to make sure that we're mindful of social distancing. And just getting some feedback there, that's okay. We need to make sure our vaccination numbers are up. We need to keep abiding by social distancing. We need to obey the public health orders. That's how we keep our community safe. That's how we keep our region safe. Now, I appreciate this can be difficult. It's still a worrying time for people, but in addition to that, for people who have not been doubly vaccinated, and this is often through no fault of their own, it's just a question that the vaccines came to our regions later. People opted to get AstraZeneca, and they want to stay, they want to keep that 12-week gap. So through no fault of their own, people aren't doubly vaccinated. So it's very frustrating, and I just want to acknowledge that, and I want to thank people for doing the right thing. And that's what this is about. And as Winston talked about this morning, we want our communities to do the right thing, and people have been doing the right thing. And we want people to continue to do that. And that's how we'll keep our community safe. So please, if you've got any of the symptoms that we've mentioned, the slightest symptoms, please get tested. Please complete your vaccination. If you haven't been vaccinated, please consider getting vaccinated, and please stick by the public health orders. We are going through a period now, a little bit of uncertainty. I recognise that. It will be a bit of a worry for people in the next few weeks. So if we just stick to those simple rules, stick to the public health orders, respect those, please. Make sure you're social distancing, masks wearing, QR coding, and also encourage people to get vaccinated, complete your vaccinations, and we'll get through on this journey and this roadmap come the 1st of December. Happy to take any questions.
Joe, we've obviously been chosen as a pilot location for the vaccination through Service New South Wales. Do you think that this is a positive thing for Wagga, and why do you think we might be chosen?
I think it is a positive thing for Wagga, actually. A few regional centres have been chosen, and I think Wagga's a community that is always ready to step up and try new things, and that's why we're leading the state as a regional centre. I think it's important to test this linking of the QR code to the vaccine passport because it will make it so much easier if we get it right for businesses to check it. And we've already spoken this morning about how we don't want the onus on business people. The onus is on us as individuals that we are doubly vaccinated. We don't want fights between business owners and customers. So let's do the right thing. And to make that as easy as possible, if we can link it to the QR code, well, that'll be great. Now, of course, it's technology, and with technology, as you all know, they all work perfectly the first time you ever do it. The first app ever. No, of course not. We've got to trial it to make sure we iron out the bugs as much as possible. And so I'm really pleased that Wagga has been chosen as one of the sites to test that, and it's going to be in a number of different venues. So we've got hotels involved, we've actually got a store involved, a big store, and we've also got some aged care facilities. So that's a range of places so that we can really get a feel for bugs, ironing out all the little errors that happen in the app. So it's good, and when it's right, then I think we'll all have that confirmed. The app will be ready to go, and it'll make it so much easier for people in the rest of the state.
Do you think there's any groups that have been overlooked in those few that have been chosen so far?
Community sporting events and clubs like that haven't been included, but I think the point is the range of venues that have been selected will get, I think, a sufficient number of people to identify most of the concerns, and I think that's as it should be. And hopefully, as we go through, we'll learn. We'll hear how it works, and then we'll extend it from there. So I'm hoping this will go well. And I'm very pleased that we're being able to contribute to the wellbeing of our state by being a pilot site.
And just on the restrictions again as well, obviously it is different for the regions compared to metro
Yep,
areas,
yep.
but some of the businesses here, like the Mel's childcare centre and Laser Tag, actually had to go backwards and close. Do you think it's fair to sort of put us in the same category as metro areas and communities?
It has been very difficult, and I'll say that right from the outset for us, because we're actually out of lockdown essentially, and in a way we're going back into a partial lockdown for people who are not fully vaccinated. That was always on the cards. The government was very clear about that from the start, but that doesn't make it any less hard for businesses and for people now, and I want to acknowledge that. Now, the great thing about a roadmap is reading it, and they're always, I'm not one of those people who's great with directions, so I always find reading the roadmap difficult. Seriously, we're going to have to work our way through this roadmap right now. Every time a public health order's come out throughout this whole pandemic, we've had to actually ourselves nut out what it meant and apply it in our own situation. And sometimes it just doesn't work, and we have to feed that back to the government. Sometimes it does work, sometimes we've got to apply it. So it is a question of working together on it. But I do acknowledge how frustrating it is. It's been brought to my attention this morning that there are some circumstances, such as the playgrounds for children and so on, where they've had to move back. And I actually think that's inconsistent with some other measures currently in the public health orders. So ice rinks can operate now. I understand in a couple of weeks' time we'll have nightclubs open for double vaccinated people. The fact that you can't have a playground for kids, such as Noah's Ark, for example, or laser tag, seems to me to be inconsistent. So I'm seeking some urgent clarification on that from the Ministry this morning, and I've been in contact with those centres. Hopefully we can clarify it. It doesn't seem consistent to me. It seems a bit ridiculous. So we need to clarify that. And of course that's part of what we've done all the way through this pandemic. We get questions all the time from businesses and concerned members of the community. I know Service New South Wales does as well, and we try and interpret those, and where they don't make sense we try and feed that back to the government, which of course is why we actually got the government to agree that people could work with a single dose of vaccine, and that's a really important thing in regional areas. We also pushed back on the travel so that you can't start the travel till 80%. So we'll keep pushing back on that, and we'll clarify that situation.
These businesses have said that there has been quite a lack of communication. They actually weren't aware until the weekend, and they've had basically one day just to close their doors. Do you think maybe the roadmap was a little bit too focused on opening up Sydney and those surrounding areas and not so much on the regions?
I think that's a very fair point. I think they're talking about this as Freedom Day. I don't see it as Freedom Day for us necessarily. I see it as the first step on the opening up journey. And we've got 7 weeks now to the 1st of December, and there's going to be a set of negotiations around vaccination status in that time. For example, I note yesterday that the Catholic churches in the diocese won't actually be opening for the next 2 weeks. So the description of this as Freedom Day, not for our region. It's first step on a journey to 1st of December, where of course the state will be opening up considerably. And so we're going on a journey, and as we go through that we need to clarify where we're going and what applies. I would have liked more notice about this. There's no question about that. It's probably related to the fact that everyone's making whoopee in Sydney because of the freedoms. As late as over the weekend actually, and late on Friday over the weekend, we've been trying to seek clarification, particularly on the issue of which workers can work and in which businesses. And I think the public health orders have only come out over the weekend. So really that time frame, look, it's not really good enough for businesses that are trying to plan. We've tried to anticipate what is going on from what the government has said, but of course until you get the public health orders you don't know. That said, I have to say, a lot is happening. They are trying to open up, they are trying to accommodate different people, so I acknowledge the work that's gone into it, but I would have been great to have some more notice, no question about that, especially for the businesses. And the fact that we're still clarifying it reflects that, so you're absolutely right.
So are we hoping to get these businesses back open? Like you said, they've been open for the past 4 weeks. What's changing just today for them?
Well, that's exactly right, but we always knew that with this particular roadmap, that the freedoms that we had for people who were not doubly vaccinated would be reduced at this point. It was made clear when the regions came out of the lockdown that we would be going back. It's frustrating. There's no question about that. It is for a brief, it is for a period of 2 weeks and then a further 5 weeks. So it's a relatively brief period. I think it is important that we take these steps to protect our region locally. We are still at risk here. We do not have the vaccination rates that they have in Sydney. And as we've seen from the local health district, we have had incursions. We have incursions of this virus. They come in from all sorts of people, and till we get our vaccination rates right up, we are at risk. So, look, I understand people's frustration, but I do think taking a cautious approach is reasonable to protect the community. Having said that, you've raised some issues about some restrictions that don't seem to make sense, and we need to go back and clarify that.
Have you had an opportunity to speak with any ministers yet about some of the businesses having to close?
I haven't had an opportunity to do that as yet. I was in contact over the weekend in relation to the trial of the service app, and certainly on Friday when we met with myself and my fellow independents met with the Premier, one of the issues that I raised very quickly was the whole process of opening up and travel and making sure that that got clarified, and that's something that I will certainly be pursuing.
And I know some businesses around here have said, this roadmap really does seem like it was written for Sydney, and in some ways it's disadvantaging businesses here. Would you agree with that?
I do agree with that. I think the roadmap, in the sense that the roadmap is this road to freedom, that today is Freedom Day, that's a city perspective. For the regions who haven't been in lockdown, we are actually facing more restrictions. Although there are some situations where there are increased freedoms. For example, visiting hospital and aged care facilities, as Jill Ludford has outlined. So it's a mixed bag for us, but it's certainly not throw your hats in the air Freedom Day. And I think that's okay, because we are on a journey here. This is the first step, and we do not have the vaccination rates that are present in the city, so we remain vulnerable. And I think this cautious approach is reasonable, but of course it needs to be as sensible as possible, and where there are genuine situations such as the amusement situations that have been brought to my attention, I think we need to look at that.
Do you have any say in when the public health orders are created, or do you just receive the public health order and then have to provide feedback or just follow it?
So my role as a local member is to advocate for my community, and we do have an opportunity to advocate to the government. We know they are developing the public health orders, but clearly they're developed within the health ministry and so on, so the people who drafted them are there. Our role is to work with the government, the various ministers, to make sure that those public health orders, as best as possible, take account of the needs of our electorate. And a good example of that was the regional roadmap in relation to travel. Government's wanting to open up travel from the Sydney region very early, and I certainly pushed back hard against that, and the orders were changed. So that's the process we use to do that. The difficulty is trying to anticipate every situation that's going to arise and how it's going to affect people one way or the other. And I am sure that in the next couple of weeks we will be receiving a lot of feedback about why I can't do this and how does this apply to me and how do I interpret this. And we will do our best to advocate on those or provide the right advice as we work through this process.
Do you feel like you're being listened to when you're advocating for regional?
I think I make sure I'm listened to. That's my role. The government, to be fair, has been open. We've had regular briefings. Certainly I've had good access to ministers and their officers in raising issues with them. It's a busy time for them. My job is to make sure I'm listened. I think the government does listen. Do they always do what I tell them to do? Well, I'm not the government, so surprisingly not. But look, seriously, it is important to advocate, and that's my role. That's what I try to do.
Please. might be two, so I just want to clarify we've got the right one.
I might get Sam to send you that information
Yeah,
so
that's
that
fine.
we've got that for you.
Yep.
Yes, actually, Wagga Fruit Supply on Forsyth Street.
Yep.
Yes,
Cool.
yes.
And just with that exposure site, where has that one come from? Is that a result of the the Kildare case again, or is this someone possibly passing through that exposure site, or what is it?
Yeah, so I do want to clarify it is not linked with the Kildare case. It is, as you have said, someone passing through the region, yes.
Is that possibly an essential worker here for work, or what were they doing in the region?
Look, as you know, we have exposure sites from time to time. People like truck drivers have to come and provide supermarket goods and supplies, and those essential workers have been coming into our district even during times of lockdown, and they're essential to keep all of us fed. So they're really compliant with their surveillance testing and making sure that if they are tested positive for COVID-19, when they return back to their residential address, that we're notified of that.
Just a quick question from Albury. Obviously they've had a sewage detection down there. Are you expecting more cases to stem from that detection?
So not at all. So the sewage detection in Albury would be most likely to be linked to the cases that we have had down there. And again, good news that we haven't seen further community transmission in the recent days or week in Albury. And the cases that we've announced one by one are all linked to household contacts.
And is that the same as the case in Wagga in terms of the sewage detection? Do you think it's more just coming from those existing cases that we already know about?
Yeah, so in Wagga Wagga, of course, we have some people in isolation who've tested positive to COVID-19, and also we have people in the hospital here from across the region. It is our COVID ward and ICU, so we would expect to see that continued Wagga Wagga sewage detection in this region.
And just last one for me, just on vaccinations. We've had reports of a lot of people pushing forward their vaccinations in order to go back to work, take advantage of new freedoms, or uniquely to go to the ag races next weekend. Obviously, some people are actually trying to push them forward earlier than the advice that the health experts say in terms of the weeks in between the vaccinations. Do you have any message to people about that, or any advice to people who may be considering getting the vaccine before the recommended weeks?
So it is really important that you actually wait for the recommended time frame between your first and your final dose of vaccination. Two things will happen if you push that forward. Firstly, you will not be able to download your digital certificate from the Australian Immunisation Register, which means that you will not be able to get into the venues of which you're trying to get fast track. And secondly, and most importantly, you won't get the efficacy, or you won't get the effect from that vaccine that will protect you, your family and the community. So I know it's difficult, but we've seen a real reduction in the time between vaccines, and it's really important now that please you wait for that full time. And I know in our clinics in the Murrumbidgee region, we actually check the Australian Immunisation Register before we give that second dose to be absolutely certain that the correct time frame has been adhered to.
But in saying that, I'm sure if they have left the appropriate time, it's something you would encourage them to kind of, move it forward to as quickly as possible?
Yes, once you've reached your time interval between your doses, please come forward and get your second dose. I mean, we've seen a great increase in the first dose vaccination rates. We moved up 2 percentage points since I was standing here last week. We're actually at 87% now in the Murrumbidgee Local Health District region. However, our second and fully vaccination rates are only at 63%. And as we've just heard, with the government easing restrictions, that's based on a 70% fully vaccinated rate. So we are still significantly behind where Metropolitan and Greater Sydney are at. So it's very, very important that people come forward. Let's get that 63% up. We want to get it up to 80%. That's where we need to get to, and we can get there before Christmas.
Is there any indication where the COVID-19 fragments of West Wyalong have come from?
We don't know. It's a very, very sensitive test, and obviously we'll keep retesting West Wyalong. But for travellers, it was a low rate, and for travellers, if they come through, stay overnight, or even use the facilities in one of the fuel stations there, the test is very, very sensitive. So what's important for West Wyalong is come forward and get testing. We'll test anybody who comes forward and asks for a test, and we'll keep that sewerage detection surveillance program going. And if we continue to get positive results, like we did in Hilltops, that's when we'll know there is most likely a case in the region.
And last week we were told that you've almost reached 50,000 doses. How close are you now after the weekend?
So I don't have that exact data with me today, but we will make a big splash and a big song and dance when we get to that 50,000. Yeah.
Yeah. And sorry, just one or two more questions. Do we have any idea where the original case in Deniliquin caught the virus, and where the original transmission happened for the Wagga Wagga case?
So look, in both cases, it was people from outside of the region visiting and coming into the locations, and those people then later testing positive for COVID-19. And I think it's really important that it's a very sad case, and our condolences go to the particular patient who has sadly passed away. And nobody goes out of their way to transmit COVID-19, and I think it's really important that sometimes people visit, they're asymptomatic, they don't know, but they come from a hotspot region. They're probably travelling legitimately if they've got exemptions. So we just need to be kind and compassionate to people. But look, as we go out of easing of restrictions, we're going to see people moving around. We're going to see people who don't know that they're COVID positive are coming into the region, and that's why those public health measures such as wearing masks, washing your hands, adhering to your social distancing steps are also important in terms of keeping us safe. We have had the genome testing results back though from the Hilltops case, and that did clearly link that variant with a case that was from the Sydney region. So once again, it's going to be a similar situation for the other cases that we see coming around.
Okay. And just one last question. How did the nurse at Deniliquin contract the virus? Did she contract it from the COVID positive patient that was there?
Yeah, so when we are caring for patients that come into hospital, we follow precautions for people who have got respiratory symptoms. And in this case, there was an exposure to a staff member at the hospital, and those cases are linked.
How did that exposure happen?
So exposures can happen in a number of ways. Obviously, for clinicians, when they wear their face mask and their PPE, their full PPE, there's a lot of things that can go wrong. And it's very, very important that our training and education is absolutely top notch. But it's always a risk, and I just want to reiterate that the services at Deniliquin Hospital, the emergency department remains open, maternity services are open, renal is open, and we've undertaken a deep clean of the ward in that facility to make sure that services can be retained. And our staff have done an absolutely superb job. Sometimes there are breaches in and people are exposed, but the most important thing is that we get them isolated early, as was the case here, that they go through their period of furloughing, which means that they are supported, and that we get them back to work as soon as possible. And of course, now we've got our staff vaccinated, it's really good because they don't often become as ill.
So was the nurse following protocols at the time?
Our staff at Deniliquin Hospital have done an extraordinary job of using PPE and following the protocols. As I said, sometimes it can be a simple thing as touching a mask and not being aware that you've done it. So they've done an extraordinary job. We're out there again and making sure that we are running people through, testing through their understanding of putting on PPE. But it's a big thing for our healthcare workers all day, every day, to be wearing full PPE, face masks, gowns, taking it on, taking it off, and you have to change your PPE regularly. So it is a matter of just supporting them to make sure that it could happen anywhere. And we've seen it happening throughout the pandemic in a number of facilities, but we will always do better.
How are they doing?
Oh, they're fine. Thank you. All right. Thanks very much.